Alrighty, so this is going to be the last session that I am reporting on. It's actually the last session that I attended to, and it was the one that intrigued me the most. It's called Living with Lupus, Common Reproductive Health Topics. The speaker is Kogi Edens, or Dr. Kogi Edens, and she is from the University of Chicago. She's a rheumatologist. She does both pediatrics and adult. She specializes in the childbearing age, or moving from being a kid to an adult. And she is one of the reproductive health specialists in the rheumatology/lupus field. So she starts out with going into the types of lupus. There's neonatal lupus, or when it's a newborn child that has lupus, discoid lupus or skin-only lupus, drug-induced lupus, systemic lupus, and that includes nephritis also. A majority of lupus patients are diagnosed in childbearing age. 20% of lupus patients are diagnosed before the age of 18. 90% of lupus patients are women of color. And most everybody has sex, and most women desire to be moms. Puberty can have an effect on lupus. It's been found that puberty could be delayed with lupus patients, and disease activity and steroid use are usually what contribute to that delay, and it's found in both genders. Can also have a delayed menstrual cycle. And it really just depends on how active the patient's lupus is, all the different steroids and things like that. Conception is really important in the care of lupus patients. You want to make sure that it's the right time for the patient and their health when it comes to lupus, and while on pregnancy compatible medications. And that's why contraception is very much recommended for lupus patients, specifically women. Other benefits of contraception include improving bone health, less mood swings, can help treat acne, help with PMS, PMDD, painful periods, PCOS and endometriosis, and even menstrual headaches. And it's also stated that also patients can flare pretty bad while on their period too. I wanted to show this slide. It's very useful. So it talks about the different types of contraception on this side, and it talks about how safe they are for lupus. And so tubal ligation or vasectomy is always going to be the most effective, and it can be used with lupus. Implant and IUD are going to be the next best. I personally have the implant. I've had it for 12 years and I've never had an issue with it. And it's also very nice that you don't have to think about it. I already have enough medications that I need to take. I already have enough doctor's appointments that I need to go to. Having that constantly working for me and not having to worry about it really helps. And here is another slide that I wanted to show. It breaks it down even more to show which methods are safe for rheumatic disease: IUD, implant, mini pill, and condom. It says here pulling out, which I guess technically would be safe for rheumatic disease, but not necessarily safe for preventing pregnancy, because there's always human error when it comes to that. And the speaker also recommends keeping emergency contraception in mind in case an accident does happen. Okay, so we're going to go into the concerns for pregnant lupus patients. There's an increased risk of miscarriage and stillbirth, preeclampsia, gestational diabetes. Up to 1/3 require a C-section. Up to 1/3 will have a preterm birth. There's more increased risk of baby having to be in the NICU after birth, and a very increased risk of maternal death. Planned pregnancies with controlled lupus improves pregnancy outcomes. So making sure to plan pregnancies can really help. Unplanned pregnancies can really mess up your body, trigger your lupus, and a lot of things like that. Lupus patients can have healthy pregnancies, but risks need to be managed. So making sure to get off of certain medications prior to pregnancy. A few of those include cyclophosphamide, methotrexate, mycophenolate, left ACE inhibitors, and ARBs. You can continue hydroxychloroquine, thiopurine, and corticosteroids. So prednisone and other steroids are pregnancy safe. And SLE patients should see a high-risk OB or maternal fetal medicine doctor and their rheumatologist throughout their pregnancy for coordinated care, making sure to get a specialist to make sure that you and the baby are both okay. They recommend the resource Mother to Baby, which is a really great resource for those who have our diseases, our AiArthritis diseases, to get more information about if your specific medication is safe for pregnancy or not. Another risk in pregnant lupus patients is antiphospholipid syndrome. And so that can happen and cause a lot of issues during pregnancy. And here's another slide that explains all the risk involved in lupus and pregnancy, talks about the different pregnancy compatible medications and everything else that you should check in with before you decide to get pregnant. So this is a great worksheet to look at. The question, will pregnancy make my lupus flare? Approximately 50% of women will have measurable lupus activity during their pregnancy. Flares increase the risk of poor pregnancy outcomes. Risk of flare is significantly reduced if planned pregnancy is preceded by 6 months of inactive disease and pregnancy-compatible medications are continued. And up to 30% of lupus patients flare after giving birth, can have new disease manifestation, including lupus nephritis. One of the biggest things that she emphasized is that after birth, a lot of doctors focus on how the baby's doing, and a lot of families focus on how the baby's doing, and not as many people check in with the mother. In this case, it's the mother that does have the lupus and does need to be checked up on just as frequently as the baby needs to be. So lupus can also be associated with decreased fertility. And infertility is defined by not being able to get pregnant in a year or more if you're older than 35 years old. And if you're younger than 35 years old, it's 6 months or more. So that's 6 months or 12 months of actively trying. Okay, and we'll go into the conclusions for this session. Lupus presents unique reproductive and sexual health challenges in pediatric, adult, and late onset populations. With careful planning, the majority of people with lupus can achieve their planning goals. And by addressing contraception, pregnancy, lactation, immunization, and bone health, the outcomes and quality of life of lupus patients can be improved. Overall, this was an amazing session and I learned so much. There is so much in this PowerPoint and in this session that was eye-opening in terms of reproductive health. I think as we go along with these diseases, we know in the back of our minds probably that this can affect our reproductive health, but for a lot of the time in our life, it's not a big priority in our life until you are trying to get pregnant. So I think just thinking about those things and being aware and being educated about, especially about birth control, even when you're not thinking about getting pregnant or thinking about having a kid. The part about birth control was like the biggest thing for me. I've always been a really big proponent of birth control, but just in general. But I think that, of course, for lupus patients, it is even more important. And I would extend that to arthritis diseases too, in general, because of how unpredictable our diseases are. Being intentional about getting pregnant is super important. Thank you again for tuning in with us for this mini Go With Us series. I hope that you learned a lot and that you had fun while learning. Please let us know in the comments or send me an email at Leila@AiArthritis.org to let us know what you thought of this mini series and if we should continue it and do more mini Go With Us's to different conferences that we go to. So let me know, and I hope to talk to you all soon. Have a great day.